Hello and welcome to our very first Career Development and Progression podcast, where we discuss career journeys and pathways. I'm Tracy Good and I'm the Continuing Professional Development Coordinator for Cambridgeshire and Peterborough NHS Foundation Trust. And today I'm excited to be joined by my special guest, Charlotte Eller, to talk about her incredible career in the NHS. Charlotte is a Queen's nurse, a Learning and Organisational Development Manager and Nurse Associate Lead for CPFT, and she's going to share with us her nursing journey spanning 38 years in the NHS. Hi Charlotte and welcome to this Career Development Progression podcast.
Hello.
Hello. So let's get started and go right back to the beginning. When did you decide that you wanted to be a nurse and why?
Well, I always wanted to be a nurse from being a little girl because at the time I wanted to make people better initially, but then I realised that might not always be possible. And as my career progressed from being a nurse into other areas, I decided that I wanted to then make or help parents to become the best parents they could be. And now I think what's important is to help people know what great care looks like and strive to help people achieve that at all times.
That's great, thank you. And back then, what qualifications did you need to study nursing?
At the time, I needed 5 GCSEs and A-level experience. I didn't actually need to have passed them, I just needed to have had the experience.
And once you'd achieved your GCSEs and A-levels, where did you apply to do your training?
I applied to 5 different schools of nursing and I applied to Charles Freer School of Nursing in Leicester to do my registered general nurse training. And I never did any care work prior to becoming a nurse. I just went straight into it from school. It was a 3-year course and I qualified as a registered nurse in 1988. At that point, we didn't really have branches or fields of nursing like we do now, but it would have been considered to be an adult field of nursing course.
Okay, so you had no healthcare experience prior to going into the course?
No, sorry.
Sorry, what areas did you want to specialise in?
No, I didn't have any experience. I just knew sort of in my heart that that was what I wanted to do. But whilst I was doing my nurse training, I went out with a health visitor for 4 days. And I knew at that point that was the area in which I wanted to work long term with my career. I really enjoy working with families and women in their own homes, and I wanted to promote good outcomes for the general population.
And once you completed your nurse training, what did you do next?
I got a job as a staff nurse at Papworth Hospital when it used to be at in Papworth on a surgical cardiothoracic ward, and I worked there for about a year.
Oh, that sounds interesting. Can you tell us more about that? What sort of things did you do?
Yeah, it was a surgical ward where there were patients who had heart and lung surgery or chest surgery. I really enjoyed working at Papworth, and during those days it was quite an interesting place to work because we used to wheel patients to and from theatre on trolleys across the car park. There were no internal corridors at that time, and I remember wheeling some patients when it was raining and in the dark, and it could be quite stressful at times.
Gosh, it sounds like it. How times have changed since then. How long did you work there?
I worked at Papworth for about a year, and obviously, as I said, I knew I wanted to become a health visitor, so I then decided that I thought I would be a better health visitor if I had midwifery experience, so I then applied to do my midwifery training.
So what made you decide to do that?
Because I didn't really have any experience of childbirth and have very limited knowledge of children other than what I'd learnt during my training. And I felt that that probably wasn't enough to be able to understand what families and women go through. So I started my midwifery training in Bedford, and I completed that training 18 months later. I worked across all fields of midwifery, including antenatal care, delivery suites, the special care baby unit and the postnatal services. And I gathered obviously knowledge and skills as I went along. Unfortunately, though, it was during a time when 3 months before we qualified, we were informed that there were no jobs for all of us. There were 9 of us in our cohort and there were no jobs for any of us. And at the time we were building a house and getting married. So it was quite a difficult time.
Gosh, it sounds very stressful. What did you do?
Well, they offered 3 posts for between the 9 of us. So we decided as a cohort that we would split the posts. So 6 of us had part-time jobs and we worked part-time as midwives. And then I did some bank work, and then I got a job on a surgical gastrointestinal ward, which was a full-time post, because I needed the money essentially at that point.
And what was it like working on a surgical gastrointestinal ward?
Well, it wasn't too great for me because I don't have a strong stomach. This rule did not suit me at all, really. I spent quite a lot of time with my head hanging out the windows, which was unfortunate because it was a high-rise building, so they only cracked open a little bit. So I did that job for 6 months, and the whole time I was trying to get a midwife's post, and I managed to secure a post after about 6 months. So after that, I went back to midwifery for a period of time, and then tried to then go down the route I was intending to go down, sort of longer term. And then I applied to become a health visitor student. So I got a place at the university, and I got the funding for the secondment. And then 12 months after starting that, I secured I qualified as a health visitor. And similar situation, when I qualified, there were no jobs. So I then went back and worked as a midwife for a period of time. And then secured a post as a relief health visitor in Cambridgeshire, which was a new post. It was a trial, and the idea was to cover vacant posts, so sickness or maternity leave or something like that. And I was proud to say, I was the youngest health visitor in Cambridgeshire at the time, at the tender age of 24 years old.
And which part of the county did you work in?
I mostly worked in Cambridge City, but I worked, because of the nature of the post, because it was a relief type, or a roaming type post, I worked all over Cambridge. But I secured a permanent post after a couple of years in South Cambridge, and then sort of moved posts every couple of years depending on the needs of the service. And after working in a post in Sawston for a while, I volunteered to leave and move to Cambourne because they were building the new village, and I wanted to be the first health visitor in Cambourne. And we worked from a container on a building site initially, so that was quite interesting.
Lovely. And how long did you work as a health visitor? And during that time, did you do any additional training?
Yes, I worked for health as I can't speak, sorry. I worked as a health visitor for about 15 years, and during that time I trained to be a practice teacher, because I wanted to be able to teach student health visitors. So that qualification gave me that ability to teach other student health visitors to become trained. And I think that was probably when I discovered my passion for teaching, which enables people and colleagues to achieve their career goals. I also did my nurse prescribing around that time as well.
What's nurse prescribing?
It's where nurses are able to prescribe medication, and it's particularly useful in posts like health visiting, where you might be visiting somebody in their own home and you detect a condition that needs treatment. And so rather than the parent having to go to the GP to receive a prescription, you can prescribe there and then, and so they can bypass that process and just go and pick it up from the pharmacy.
Oh, that's interesting. And then what did you do next?
Over the next few years, I worked in lots of different health visiting areas and posts across Cambridgeshire. As I worked as a practice teacher and also went into management posts. And then later on, I worked I applied for a post in education, and I think probably that was the making of me, really.
And what made you decide to go into education after doing all your nurse training?
I think being able to influence the workforce and the care, although it's not first hand anymore, but being able to influence and gatekeep a little bit the the level and quality of care that's provided across all fields of nursing and actually allied health professionals now. I think that's probably my motivator, and I find that really, really satisfying.
And since you've been in education, have you done any additional training?
Yes, I did a top-up degree in education at Anglia Ruskin University, and I'm going to boast I gained a first-class honours degree. And the reason why I'm saying it like that is because it was very surprising that I was able to achieve that. Throughout my childhood, I'd been told by teachers that I was a late developer and was always waiting to bloom into this academic person. But they were right. I didn't achieve my degree until I was in my 40s. But I think there probably are a lot of people in the position that I was in, thinking that they can't do things at a certain level. And actually, if you get the right support and help, and all things are possible.
Definitely. And in your educational role, have you been involved in any special projects?
Yes, I was lucky enough to be involved in the development of the Nursing Associate programme, both the curriculum and the recruitment of the first cohort of Nursing Associates. This was history making in nursing, and it was very exciting to be welcoming a new nursing role into the NHS. I'm a firm believer that Nursing Associates are one of the best developments within the NHS over the last 30 years, and I feel honoured to have been part of that journey.
Wow. And we mentioned at the beginning that you're a Queen's nurse. What is a Queen's nurse? Does it mean that when Her Majesty's under the weather, you get to go to the palace and take a temperature, or what does that mean?
No, we don't get that privilege. A Queen's Nurses Award that's given, and you also receive rather a lovely badge and a rather nice presentation, and it's given to nurses in recognition of their service to nursing. And in my case, it was for services provided within community nursing. It's quite a prestigious award, and when I received mine, I did feel very proud.
And so you should, and we're very proud of you. So what do you like most about your role?
What I like doing most about the job that I'm currently doing is that I'm able to influence the care that nurses and allied health professionals deliver. And I also work in a team of wonderful people. The team I work in are so skilled and knowledgeable that that's what makes me want to go to work in the morning, because we're all striving to achieve the same end goal, which is to improve patient care.
And during your career, have you been involved in any special projects?
Yes, I've done lots of different types of projects. When I was working as a health visitor in Huntingdon, I was involved in the Healthy Child programme. I was working for Cambridge Community Services at the time, and I worked with the Department of Health and delivered presentations at their conference regarding health visiting and the challenges we were experiencing at the time. I also led on the recruitment of health visitors during the Call to Action campaign, which was really interesting to work with a different organisation or different organisations, because whilst we all wanted the same thing, we all came at it from different directions, which made it quite fascinating.
And what about leadership programmes? Have you done any of those?
Yes, I've done lots of leadership programmes too. I actually think the most useful way I've learned to manage a team is by observation. I've been managed by some, and this is quite sad, I guess, but over the years I've been managed by some truly terrible managers who demonstrated how not to manage people. Conversely, I've also been managed by a few nurses and midwives who helped me to develop a way of behaving, which I hope has made me a good role model. Some of the behaviours I observed were outstanding. I try to be interested in people and compassionate. I work hard and expect the people I work with to do the same. We're spending taxpayers' money at the end of the day, and I think it's vital that we provide the best service we possibly can. And I try to think that everything I do has an impact upon patient care, not directly, but if I can influence the quality of the learners during the training, then they will be better healthcare professionals when they qualify, and this will drive up the quality of patient care. So that's what I turn up for work for, really.
Brilliant. So what's next for Charlotte Ella, Queen's nurse?
Well, I'm very fortunate that I'm able to retire early, and I'm not retiring. Well, I am retiring because I want to, but I'm mostly retiring because I can. And I'm very fortunate to be in that position. I've had a very long and what many people might consider to be a successful career, which I've absolutely loved. Absolutely loved it.
Brilliant. And finally, do you have one piece of advice?
One piece of advice. Yes, I think if you can remain curious, that is really helpful. Professional curiosity is one of the most effective and important skills, I think, as a health professional, or for anybody actually. If you remain curious about your practice and have an open mind, then it means that the standard of care that you'll deliver should make a difference. And kindness. Sorry, you asked for one thing, but kindness costs nothing, and I think that's really important.
Brilliant. That's great. Thank you, Charlotte. So that brings us to the end of our first career development and progression podcast. I'd like to say a huge thank you to Charlotte for joining us and sharing her career journey. Thank you for listening, and I hope you feel inspired to follow your own career goals. Be sure to look out for our next podcast, which will feature the career journey of an allied health professional. But until then, this is Tracy Good, and as Charlotte said, don't forget to remain curious.